Freddie, if you can you please walk us through like what kind of different COVID-19 tests there are? I know some of the public is aware of PCR versus antigen, the accuracy of either or, and is there a circumstance where we'd use one over the other?
Right. So yeah, PCR and antigen are the main tests we use. I know you might hear of antibody testing for people who want to know if they actually have antibodies against COVID, but that's like a whole nother story. For our purposes in detecting COVID-19, we have PCR and antigen tests. So PCR tests are the gold standard. These are the tests that we use in the healthcare system, to help with diagnostics, to confirm that people have COVID-19. So some of the great things about the PCR test is that it's super sensitive in detecting COVID. So if you are someone who has a small amount of virus or you're early in your infection or exposure, usually PCR tests will be there to catch it. Some other good things about PCR tests is that there's a less of a chance of a user error because you have a lab professional who's going to do it at a lab. And for the most part, most PCR tests are actually free at most test centers as well. And also, the PCR tests are accurate against all COVID-19 variants. So that's a really good thing. Some of the cons, though, with PCR tests is that it takes 1 to 3 days to figure out if you're actually COVID positive. So if you're someone who's trying to prevent spread, it might be hard if you have to wait a few days to see if you're even COVID positive. And some other things is that for people who might not have insurance or go to a different facility, it might cost a little bit of money, so it might be a little bit expensive. And another thing with PCR tests is it might be hard to travel to a test center that's not close to your house, and making an appointment and trying to get testing is a little bit difficult right now. So that's just something that really makes PCR tests a little bit limited. It's a really great tool and we trust it a lot. It's just hard to do it sometimes, especially with all the long lines in Stockton and all the testing sites. I actually heard when I was talking to Kurt, the ABC news reporter, he said it took like about 4 or 5 hours to get a test at one point. So yeah, that's pretty crazy. But as far as antigen tests, so antigen tests are really great in detecting COVID-19 parts, or not just the genetic material like PCR, but actually some of the parts that get broken up with the virus when you do have an infection. So the spike protein, the virus genetic material, some of the parts of the virus capsule and things like that. So antigen tests are really great because they take 15 minutes to result. So what you can do it at home in your own safe space, and you can get a result right away and know if you're infectious. Some other things that are good is that you can purchase antigen tests over the counter. Maybe not right now because we're somewhat in a shortage, but I did go to my local CVS and picked up a few. And actually the line to get into the store was a little bit long, but other than that, they're pretty accessible. And hopefully as we get more tests, that'll be something that everybody can get. And also, it's much more easier to take the test because again, you're doing it at home. As far as some of the results, because it comes in so fast, you're able to know right away if you're infectious and then you can, prevent infecting others right away. Whereas again, the PCR test takes a little bit longer. Some other cons though with the antigen test is that it's not as sensitive as a PCR test. So one of the problems in the news right now is that people who are taking antigen tests are taking them a little bit too late. So by day 7 to 10 is the lowest point of the Omicron viral load. So some people might take it at day 9 and then they'll test negative, or they'll take it too early, like at day 1 or 2 after exposure, and they'll also test negative, which can mean a false negative. Some other things that make antigen tests a little bit less beneficial is user error. So obviously you're doing the test at home. So if you don't know how to follow the directions, sometimes people can inadvertently mess up the solution. And one example of that is that some people nowadays apparently are using the swab, and instead of doing it in their nose, like the instructions say, they're actually doing it in their throat, which is something that I found pretty interesting. I don't know exactly where the data for that came from, but For all of the antigen tests, you should really just follow the directions and what they're approved to be for, because, for instance, if you were to swab your throat, the acidity of your throat is a little bit different than your nose. So you might actually mess up the buffer solution that's in the testing. So that's something that not a lot of people think about. They think, oh, my throat is only a few inches away from my nose, so why don't I just get a better, test for my throat? Another reason why that's a bad idea is it's a little bit more invasive. You can potentially knock something around in your throat. The tip of the Q-tip might break off and cause like a choking hazard. That's another thing. So those are things you want to avoid and just follow the directions, and that can be a con of antigen tests. And another thing would be that because people are not testing at the right time, it could produce false negatives. So in order to test with antigen tests correctly, you should do serial testing. So most testing kits come with 2. And you should do one on day 1, for instance, and then another one at least 36 to 48 hours after, in order to kind of confirm that you're either negative or positive. So that's the one thing that antigen tests kind of lack with. Does it kind of answer your question?
Oh yeah, it definitely answers the question. I know testing can get pretty confusing for the public, and there's a lot of guidance. And just continuing with that, like now it's just like the after action results when you do get your tests. So
right.
Do you mind elaborating a little bit on the guidances of, for those who test positive versus negative, isolating and quarantine? I know vaccinations do play a factor in sort of that timeline. Do you mind touching a little bit on that? Yeah, that was tough.
Yeah, so recently the CDC just had their guidelines updated. So kind of just reading off of what I have here, if you test positive, that kind of starts your day 0. So if you do test positive from day 0 all the way to day 5, you should stay at home. And then after that, you should really be monitoring your symptoms. So something that I tell people is that the 2 most important things you should look out for is timing and symptoms. So again, if your symptoms start, that is your day 0, or if your COVID test is positive, the day that you took the test, not the day of the result, would be your day 0. So based on the CDC guidelines, regardless of vaccination, once you hit that day 0, you should wait at least until day 5 and continue to monitor your symptoms at that point. At day 5, if your symptoms are still there, continue for another 5 days. That kind of restarts your, or until your symptoms resolve, all the way up until 10 days. So for a total of 10 days, you should expect to either quarantine or stay away from others. And that's pretty much the gist of what the CDC is getting at. And the reason why they updated their guidelines to 5 days of staying at home and then monitoring and seeing if you can come back before the 5 to 10 day period is because of what we've seen over the last couple of years with COVID-19. So mainly after day 5, most of the viral load starts to come down, and then you're less infectious. But they say with any of these cases where you test positive or you're exposed to someone, in the last half of that quarantine or isolation period, and when you're able to go out because your symptoms are resolving, you should really be as safe as possible. So let's say you're someone who tested positive at day 0 and had some mild symptoms, and at day 5, your symptoms are pretty much resolved. You could still potentially be infectious. So between day 6 and day 10, you really should, if you do go out of the house, be extremely safe, wear a really tight-fitted mask, and don't attend any gatherings and things like that. I think that's what the CDC's intentions are trying to get at with these guidance. Yeah, so that's basically the gist of it. I do have some scenarios here that I ran into this week, so maybe I can go over those if that's cool.
Yeah, we'd love to hear about your experiences.
Yeah, so one scenario was at day 0, the person had symptoms and they isolated since day 0, and at day 5, they tested positive. So they asked me, when is their day 1? Right. So their day 1 starts at their first day of symptoms. So that's one case. And then if they're positive on day 5, they should still monitor their symptoms until day 10. And if they still have symptoms, they should monitor until they don't have a fever for at least 24 hours. And that's their time period of isolation. So also there's the vice versa, where someone at day 0 tests positive, and then they don't have any symptoms until day 5, and then they get symptoms. And then they ask me, okay, which day is my day 0? Like, when do I start quarantining, right? So if you tested positive at day 0, you should be quarantining for 5 days. At the 5th day, if you do get symptoms, per the CDC, you'd start your day 0 over. And then you kind of follow the guidance we just talked about, where you monitor your symptoms for 5 days. And then if they're better, the next 5 days, for a total of 10 days, you can go outside and wear a mask and be safe. That kind of makes sense. It's kind of confusing, but I was reading it over the last few days after we were talking about it, Kevin, and it actually makes a lot of sense. I mean, the big picture here is to protect yourself and everybody else in the second half of the infection, so the day 5 and day 10. One thing to note is after you test positive for COVID and you have like a legit infection, you might test positive for up to 3 months after your infection. So I think that's something to always think about. If you do have to go back to work, I know that some people are requiring a negative test before you can get out of isolation, but in actuality, you might test positive for a while. So I think that's something to think about, and let your employer or whoever know that I'm asymptomatic for 24 hours without a fever, and per the CDC guidelines after 10 days, so that I am no longer really infectious.